Hey, coming up, we're going to help you get on your feet. Specifically this guy. He's a podiatrist, and he's our expert today. Dr. Russell's here to take your questions. You can reach him at 419-534-5430. Your podiatry questions are front and center today on Ask the Expert. Dr. Corey Russell joins us with the answers to your questions. Good morning, Dr. Russell.
Good morning. How you doing?
Good. First question. When this person gets out of bed in the morning, he or she gets a sharp pain in the bottom of the heel. What is that, and what should that person do?
Well, that's a common problem we see actually in the office, unfortunately. What the problem is what we call heel spur syndrome, which is a common problem we see throughout the population, especially with people that are on their feet extensively, especially on hard cement floors as part of their job. What can you do about it? Well, stretching exercises are typically the best. Stretching exercises, ice massage to the heel, 10 to 15 minutes a couple times a day. Anti-inflammatories are usually a benefit. Sometimes arch supports in the shoes, and we make custom devices through our office. Physical therapy is sometimes a benefit, and we get patients into physical therapy. And of course, sometimes we give them the dreaded steroid injection in the heel. But that seems to work pretty well for treatment.
The dreaded steroid injection, is it painful?
People aren't necessarily fans of shots and needles. That's a common issue, but typically the shot goes very well, and they do very well with treatment with it.
Okay, next question. If you have a large bump on the side of your foot near your big toe and it becomes difficult to wear shoes, what is that and what should you do?
That sounds like what we call a bunion deformity, which we typically see in the older population, and certainly shoes can aggravate rubbing on that bump, and it causes redness, swelling, and pain. Now, what can you do about it? Well, wider shoes are usually a benefit, so it doesn't rub on the bump, so more of a square-toed shoe is a benefit. Anti-inflammatories can sometimes benefit, and sometimes padding over that bump to prevent rubbing of shoe wear. If none of those things work, then I'd probably recommend seeing your local podiatrist and discuss possible other options like surgically fixing it so the bump is no longer there.
All right, now here's a personal question. Not my feet, but my son's. He's 3 years old. He has toenails that are little and thick and crumbly and yellow, and we've been told there's really not much you can do, but what is that, and what would you recommend?
Well, a thick yellow crumbly toenails typically is nail fungus, which is very common throughout the population. It's sometimes seen in younger kids, but usually seen in adults, and especially older adults and diabetics. What can you do about it? Well, in a young child, 3 years old or so, I'd probably look at a topical medication for that. As the patient gets to adulthood, depending on other medical issues, we're looking at topical medications as well as sometimes oral medications, which is usually about a 3-month dosing.
All right. Well, he's always been like that. And they've just said, hey, he might grow out of it and it doesn't hurt him.
That's possible. It's possible.
All right. One last question. Someone who has frequent ankle sprains, what can you do to prevent those?
Yeah, ankle sprains is a common problem. Obviously, we see that all the time. People that get chronic sprains can sometimes have a stretching out of a ligament on the side of the ankle, which makes it sometimes weak, and you're prone to more sprains. So what can you do about that? Well, you can do some stretching exercises, you can do some strengthening exercises to accommodate for those ligaments that are stretched out. And sometimes it requires bracing as well. Now, if the ligaments are torn or stretched out to the point where strengthening is not going to help, sometimes that's a surgical issue where we go in and tighten down all those ligaments on the side of the ankle.
And as always, check with a podiatrist. Thanks very much for coming in this morning. We appreciate it. Next week on Ask the Expert, Dr. Robert Heiselman will be